Hello, it's Dr. Eric Potter from Sanctuary Functional Medicine for another Facebook Live. I hope everyone's doing well. We've been fighting a little bit with computers between noisy neighbors and a computer internet that does not want to hook up. Hopefully we are able to broadcast this whole edition without having any other snafus or getting clogged up. So if you do have problems with hearing this, let us know. We may have a little bit of an echo. We're having to be in a room where it's a little quieter than our noisy neighbors who are doing some machinery. So with that, we are going to talk about the limbic system today. The limbic system, part of the brain that plays a part in many of our patients' health recoveries, both in the keeping them from recovering and in helping them to recover by treating those issues. So with that, we are going to take our usual time of talking about the limbic system for about 15-20 minutes, and then we have a few questions, or if you have any other questions, you can type those in below, and we will be trying to answer as many of those as we can get to. So today is the limbic system. The limbic system is a part of your brain that sits deep inside, and we're going to try to explain where it is and what it does, but do that in a way that makes some sense without getting in so deep that we all get lost in the details. So with that, think about your brain as two halves and has a split down the middle, and in that split, if you pull that apart and look down into that valley, you're going to see parts of the limbic system on the surface, and then as you go deeper out from there, other parts. It is made of a lot of different structures, that all work together. And before we get into those details, I will say that why do we care about this part of the brain? Well, in short, it has to do with our emotions. It affects how our fear, our other emotions that are not as disruptive, and it also affects how we remember things, how we make decisions. And you're like, hold on, how does that all fit in together? Thought it was just about fight or flight response. Well, what it is, there's research, as we have found others. Different patients have strokes or injuries or accidents, and we learn about different parts of the brain. And what it turns out is this part of the brain affects not just how we feel, but how we make decisions, how we think. So for our patients, often that means when mold or trauma, such as PTSD, or potentially PANS or PANDAS, the pediatric autoimmune neuropsychiatric syndrome, or the disorder associated with strep, antibodies attacking that, or just other toxins causing inflammation in this part of our brain called the limbic system. What can happen is those pathways get overactive, and instead of helping you, yes, you see a bear, you see a bad guy, and you want to run, it becomes that you are always feeling like there's something after you. You always feel like that you're in danger, and your body can never settle, and that has a lot of secondary repercussions. So with our mold patients, this part of the brain has been affected many times, and it is so revved up. Patients have hypersensitivities, not just to mold, but that can include things like just perfumes, even foods, smells in your home, especially VOCs, the volatile organic compounds that pervade our world because we're poisoning ourselves. Just walking, if you walk into a mall, I tried not to do that, but I had to do that recently and was overwhelmed by just all the smells that are there. We're bombarded by those things. Most of us, it doesn't really help us. It doesn't necessarily, those things aren't good for us, but if you are one of the multiple chemical sensitivity patients where their body is hyperreacting, it could be your limbic system that's doing that. You may never be able to settle down, or if you're exposed, even when you're not exposed to those things, your body is just waiting for the next danger to come along. So our patients can have the memory problems, brain fog, constant fear, anxiety, heart racing, palpitations, both subjective and objective symptoms. Subjective meaning things internally that somebody couldn't necessarily see, and also objective symptoms meaning something that someone else could see, like hives, swelling, things like that. But most of these are going to be subjective. They may even include pain, they can include headaches, they can include vision changes, a lot of emotional states where you have mood swings, anxiety, depression, especially after someone has been in fight or flight for a very long time. They can have depression symptoms that were provoked by the anxiety that was chronic. So our patients can become very debilitated. And our first thing is to try to get those toxins, whatever was causing that, out of their lives, whether it's mold toxins, whether it's Lyme, whether it is other metal toxins, can be yeast and the chemicals they produce. But we try to get rid of those things. Now, sometimes they are episodes of abuse or trauma, car wrecks, abuse victims from the past where just like an army, someone in the army who's had PTSD from being in battle, they can have PTSD, post-traumatic stress disorder, that continues. And when you throw gasoline on the fire with mold or some of these other toxins, Bartonella and Lyme as infections, those patients can get stuck. And even when the infections are gone, their body can't heal from that. Now, those episodes are hard enough to deal with, but with the toxins on top, that part of the brain, the limbic system, which then communicates with the frontal lobes, which play a large part in how you make decisions, decision-making processes, you have a lot of problems. You get stuck, you freeze up, you can't make decisions about things, or it affects the fact that the limbic system interacts with your hippocampus, which is a big part of your memory, and the entorhinal cortex, another area in the brain deep inside, is one of the first areas to degenerate when one has Alzheimer's, is playing a part with memory. So with all these, patients can have a myriad of symptoms, both neurologic, psychiatric, and physical, because in relating to the hypothalamic axis, which is your hypothalamus and your other organs of the endocrine system, such as your adrenal glands, which release adrenaline and cortisol, your limbic system can trigger release of stress hormones, which is appropriate, again, if you're being chased by something trying to kill you, but not so appropriate if it's day in and day out when you're just going about your normal business, taking care of your kids, taking care of work, driving to work, driving to the store. You do not want adrenaline surges, and that you might have if you had road rage. That's not what we're hoping for. So with that, you can have physical symptoms, blood pressure going up and down, you can have the palpitations, you can have chest pain, you can have sensations of shortness of breath, you can have sensations of vertigo. So you can have a lot of symptoms, physical, that are not just mental, neurologic related, from this system. So stepping back again to the anatomy of things, is we've talked a lot now for a few minutes about what can happen in terms of our symptoms, or our patients are experiencing symptoms and why. But looking at this, we can see how it is being at the center of the brain, areas like the cingulate gyrus, the hippocampus, the reticular activating system, different nuclei that we can go through, a ton of different names that will really mean little to you, but the complexity is not, oh, this part of your brain does this part does this part does this. There's different areas that are responsible for interacting with several other areas that control that function. So when the limbic system sitting in the middle is relaying, when you see a bear coming at you, your body actually reflexively turns and runs before you even think about the fact that you need to run from that bear. You have an automatic response that bypasses your thinking, your cognitive, your conscious level, and goes straight to response. If you have a traumatic memory, the stronger that response is in the limbic system, the more ingrained it's going to be in the hippocampus and in your other parts of your brain that have to do with memory. Now, let's just take an example. I mentioned earlier that a lot of what we know is by how people have had strokes or brain injuries in certain parts of the brain, that when that was gone, we realized, oh, they lost some function. There's a guy, been 50, 60 years ago now, I think it was the 40s or 50s, who had a damage to part of his frontal cortex, which is the surface of the brain that connected. It was right over the eye, the supraorbital, that connected to the limbic system. With that, he was still functional, but as he would describe it, he can think, but he could not feel. he lost the ability to have emotions, which meant he was very flat. He could, if he listened to music, he could think, oh, that was music, made these notes, these sounds, but he couldn't express emotion like liking something or enjoying something. And so that's kind of bad enough, but it was very interesting because scientists realized he also could not make decisions. That our emotions, it's not just our rational, our logical part of our brain that makes decisions, but we need emotions to determine what's valuable, what's not valuable, and help us to do left or right, choice A or choice B. So this person that they followed never was able to feel. It was interesting. He could remember that he used to feel. He used to like or dislike certain things, but as far as experiencing that sensation, he could not. Other areas of the brain, when they have been removed, there was a famous patient, HM, who they took out part of his brain and found out, oops, he wasn't able to remember. From day to day was like it was a perpetual new day. He could not remember having met the doctor that ended up caring for him for 40 or 50 years, I believe. Could not remember ever having met that doctor before. Now, could remember how to learn tasks. He couldn't remember that he knew how, but they did determine that his different parts of the brain remembered different parts of life. So with that, we realize how central our limbic system plays a part in things. Back to what I was saying about many of our patients is when you have fight or flight, if you're really, really worked up, it's like really adrenaline's pumping, your heart's racing, it's often hard to make decisions. If you're really anxious about something, it's hard to make decisions because you need your limbic system to be functioning correctly in order to do that. Now, if it's under functioning, that can be a problem. Like I said, in that individual patient that had, not our patient, but someone in decades past, had an injury to the limbic system, they couldn't. So with that, things like the amygdala, another part of the limbic system, has to do with fear. So if you don't have an amygdala, you're not going to be able to really fear things. However, if you have an overactive amygdala, you can be fearing everything, or you can associate fear with a situation that should not be fearful. Now, again, if you connect that with some chemical sensitivities that trigger your limbic system, a smell of a perfume, or we all know, that medicine that our mom gave us when we were little, she happened to mix it in with peanut butter or put it over some fruit, and you never want to have that fruit again. You smell that fruit or smell that peanut butter, and you think of that nasty taste of that medicine, bitter medicine your mom gave you 50 years ago. That's connected through the amygdala and through the limbic system. Now, imagine that everywhere someone goes, they're smelling something that's triggering that kind of emotion. It's overwhelming. They never can really rest. They go to sleep at night and they start having those things come back up. So we've talked a lot about what can go wrong, how it goes wrong, kind of some parts of the brain that are involved in that in the limbic system, and how it's connected to other parts of our brain. But we haven't said anything about, is there something you can do to help that? Now, first of all, if somebody has an organic injury, say a bullet wound or a stroke in that area, our brains have something called plasticity, meaning it's not just concrete, you can make changes. Now, changes in the brain take time, take some effort, but our brain can work around, even patients with strokes can work around that if the stroke's not too big or if the interconnecting pathways can be rerouted. So with that, we are going to talk about using plasticity, meaning some flexibility in the brain to overcome problems, and how that fits in with what we do for our patients. So I also mentioned earlier, first we want to get, if mold toxins are pushing the limbic system in the wrong way, we want to get rid of that. If there's other toxins, if yeast, if whatever other imbalances, we want to remove those because we want to remove what took a patient from wellness into illness so that we can start moving them back from illness into wellness. So we work on those things, and then either early on, and this is many of our patients, we've referred to some different sources to get this help with this. Sometimes patients need it a little bit sooner because their limbic system is so overdrive, they can't tolerate the therapies that will get rid of the toxins that is causing the problem in the first place. It's like trying to pour water on the fire, except the fire is burning the water as well. So sometimes patients need this early on. At other times, it's one of the last things we do when patients have gotten those toxins out. They've healed, but they still have some sensitivities. They still have some symptoms. Labs are better, but there's something still not completely healed. And looking at that end of things, we are helping patients to restore proper functioning. And sometimes it's in the middle. So we work with patients at different times along the spectrum to do therapies that get that limbic system to retrain, to turn down its response to an otherwise innocuous chemical or smell or event, and not over respond and not send adrenaline or send too much noradrenaline or cortisol to the rest of the body. So some of the ways we can do that, there's some limbic system retraining. You can look at, there's a lady named Annie Hopper, has a dynamic neural retraining system. It's kind of a do-it-yourself. It's a good bit of homework. I've watched some of her lectures. I've not done the training myself, but I know enough patients going through it that many have gotten a lot of benefit, but they have to be able to do it. If they're so incapacitated from, say, mold, that they're having trouble, they may not be able to do an hour of homework that she recommends in that program. So they might be better for a one-on-one other doctor than I'm going to talk about in a minute. But the dynamic neural retraining is really trying to reset where your limbic system is not hypersensitive and lowering it down. Now, are there other natural therapies or medicines? Sometimes we will use medications that lower adrenaline responses. Sometimes we will use supplements that lower inflammation, that are pushing the limbic system. Obviously, we want to detox, like I talked about. Sometimes we'll use things to increase the inhibitory neurotransmitters, things like GABA, which can, if a brain is inflamed and hyperactive, you can lower that. Sometimes it's providing some building blocks for serotonin, another calming neurotransmitter. So we'll work on those things, but then some patients need something like the dynamic neural retraining, and we refer them out for that. Or there's a Dr. Lindemann, who's out of Kentucky, who will do video visits where he basically walks kind of more on a one-on-one and helps patients through some physical exercises, similar, not unlike Annie Hopper's DNRS program, but he'll walk through that more one-on-one, and you have some more video visits where he's working through this with you. And in result, you're kind of trying to do some of the same things, is you're trying to turn off those automatic reflexes. If you smell something or have a memory that it triggers all these emotions that should be completely disconnected, you may not even realize what's triggering that, but sometimes it's pulling that out, which leads to another therapy, EMDR. So that is a counseling technique where therapists who are trained in that will walk a patient through bringing back some past traumatic events and helping them process those, disconnect those from the present, and helping them find a safe place now, which is kind of what DNRS and Dr. Lindemann would also talk about, is helping patients feel safe and not in danger where they are right now in the present. With that feeling in danger, they're not able to relax, they're not able to heal, their body's constantly in fight or flight. If you get them back in healing mode because they're feeling safe, their body can go parasympathetic, which is the more regenerative, digestive, regenerative growth stage rather than the fight or flight, run for your life stage. So those are some of the ways. Going through counseling often helps patients process things a little better and recognize how, they're mentally responding to some things. But a lot of times the counseling is not enough because it's a biological connection that needs to be rewired. But at the same time, having a sense that you have a safe place, which is where I would encourage our patients to have look to their faith in a God who provides safety even in the midst of storms. So even when the storm is raging, whether it's his disciples in a boat, whether it's when, actually a couple of times walking the water, or when you sleep in the boat, he is still caring for them, and they do not need to be afraid even when the city is surrounded. So having a sense of safety in your faith that God is caring, using that strength then to walk through some rewiring, some redoing the software of how your limbic system is functioning. After you've gotten the trigger out of the way, doing some healing where your body stops setting off all the alarm bells, because that's really what the limbic system, when it's in overdrive, is like working in a building where the beep, 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 the alarm is going on and on and on. It's so loud you can't think. It's so loud you can't make decisions. It's so loud you start having a headache. You start hurting. Your heart races. Well, that's what our limbic system is doing to us. So, for our patients, getting rid of what drugged them into illness, helping them to get into a healing mode, often includes the limbic system and its interconnection with hormones, like I said, cortisol, both the adrenal over and underdrive, adrenaline rushes, mental health, interlaces with their faith. And we try to walk patients through this, again, with using some outside resources of either Annie Hopper or Dr. Lindemann. Some patients use the EMDR or sometimes some counseling that helps them through that. So with that, hopefully, that was a whirlwind. That's like trying to describe a tornado, because that's what many patients feel like when they have limbic system overdrive. But to get your hands at least partly around that, and understand what we do for our patients, and what you might, if you're not one of our patients or you're thinking some of these things sound like what you're going through, you might look at some of those resources, whether Dr. Lindemann, whether it's Annie Hopper system, EMDR, or others. So with that, I'm going to turn over to some questions and answer them. If you want to leave questions, I'll be working through those until we're done. Leave those on the Facebook page or at AskDrPotter.com, or if you're watching this later and you think of some questions, we try to watch that and get back and answer questions, even if it's tomorrow or the next week. So with that, I'm going to look at some of the questions that came in. So, how do you calm down a limbic system that is in hypersensitive overdrive? From Laura, thank you. So as I was saying, there's a number of different ways. And it's not just perfectly one size fits all for everyone. Depending on how much time and energy you have, you can choose whether those different Annie Hopper, Dr. Lindemann, EMDR. We're also looking at getting neurofeedback started in our office in the coming weeks, which is a more passive way where you're just kind of receiving some input from a neurofeedback, kind of like a biofeedback process. All those are ways that can reset that limbic system. We to tone down inflammation, provide nutrients to the brain to function correctly or to heal, work on leaky brain, just like we do with leaky gut, where some things cause too much inflammation in the brain. So it is for each person we see, it's going to look a little bit different, but we have a dialogue with our patients to say, oh, here's some options. Which one of these feels like would be a good fit for you? Occasionally, we'll have patients who do both Annie Hopper and Dr. Lindemann, and then the other things we talked about that we're doing for them. Often they just choose one or the other, but we've seen many who were not able to eat but say 10 or less foods, maybe even 5 foods, because they were so overly sensitive with their limbic system. Going through this, they're able to eat, they're gaining weight. We've seen a lot of success stories from this. It's not easy, like much of what we do for chronic illness, but we do see success with it. Amy. Amy is sharing a resource. We'll just go ahead. A resource about building biologists with chemical sensitivities, and we may post that up there on the website. Just a lot of the patients we have are having trouble finding safe housing. Finding a safe house that doesn't have VOCs or some kind of harmful chemicals is difficult these days. Even if you don't have limbic system overdrive, it's not helping you to live in those places and breathe. So there's some good resources out there. Carol has asked a question: what can be done to repair the damage to the HPA axis limbic system, being caused by mold, Lyme, and other neurotoxins? A couple more questions there. I'm going to take them one at a time. So for the HPA axis, hypothalamic, pituitary, adrenal. That means from your brain to your pituitary to your adrenal glands, which plays a part in the sympathetic system, the cortisol and adrenaline rushes. We look at those often with saliva tests to see where somebody's cortisol is. Some of the testing we use will look at how you're breaking down your adrenalines, what they're called catecholamines, just a class of chemicals that happen to include your adrenalines, or epinephrine is the other name for adrenaline. We will look at ways to calm that down, help your body use adaptogens, lowering inflammation. Inflammation will drive that limbic system, will drive that hypothalamic pituitary HPA axis. So whatever we see that's dysfunctioning, that could be pushing somebody down the wrong way, we are going to work on that. So it's a long list of things, just because it depends on each person, and we're not going to just try to fix one thing, but whatever 3, 4, 5, 6, 7 things we see that it's not functioning correctly, we're going to try to work on. What supplements or therapies would result in the fastest healing? First of all, the fastest part is we've got to get a patient away from the toxins, away from the infection, away from the trigger that is pushing their system down the wrong road. It's kind of thinking about if you go to McDonald's and just take some vitamins afterwards, yeah, you're throwing some water on the fire, but it's still on fire. If you are still having toxins in your body, we can throw a lot of antioxidants on there, but it only goes so far until we get those triggers out. However, once those triggers get out, we may have an easy time or a hard time of getting the inflammation, kind of getting everything healed up. Depends on how much damage has been done. Kids may not have had that much damage, and their bodies are able to, again, more plastic, meaning they're able to recover and be more flexible and recover from injuries, whereas adults, as we get older, it's a little harder. So it is, depending on the person, it's going to be a little bit different. Is it possible to completely heal the damage? If so, what's the general time frame? Again, for kids, that might be 4, 6, 12 months. For adults, sometimes they can be 1, 2, 3 years, maybe even more if someone is in their 60s or 70s, just because they may have been in mold, or may have had Lyme for 20 or 30 years, or mold for 40 or 50, or maybe their whole life. They've got a lot of damage. It is just a step at a time. We really encourage patients not to get overwhelmed when they feel like there's miles and miles of recovery to go. Take it a day at a time. People do recover. People can recover. I wish I could say everybody was going to recover in 1 month or 2 months, but most of the time, the illnesses we're dealing with are things that patients need 6, 12, 18, 24 or more months to truly see their body recover. So I keep looking for a faster silver bullet to make that happen, but it's just not there. You can see a lot of promises on the internet. Just do this, and in 1 month you're going to feel wonderful. It's not that simple. If it was that simple, then everybody would be better. Since it's not, we keep working to look at across the whole web of our health to see where we can push things in the right way to get patients better. So the next question, does it sometimes take a combination of retraining therapies? Done DNRS and working with Dr. Lindemann. Opinion on neurofeedback, please. Thank you for this live event. So, thank you, Starry. So, again, everybody's a little different. I've had patients have success with both, and I've had a handful of patients who have done both in terms of DNRS, or even using EMDR, DNRS, and, say, Dr. Lindemann. And sometimes they use one earlier in their therapy, and they use another one later. So each person is going to respond a little differently. Some people need a little more hand-holding walking through there. If they have a lot more insight, they may be able to do it themselves. But if they're like, their head's kind of spinning, they can't wrap their brain around doing the self-program with Annie Hopper, having Dr. Lindemann just walk them through step at a time is very helpful. And also knowing, sometimes when we're even as a doctor trying to take care of ourselves, when you're in the midst of an illness, and you're trying to give care to yourself, it's hard. So having somebody there to walk through that with you may be better. The neurofeedback is a little more of a scientific way. Those are all scientific ways, but this is more of a technological way, I guess is a better word, in which you are getting a brain map where it evaluates different brain waves in different parts of your head. It evaluates that and can sometimes relate. It's not a one-to-one correlation, but if you see more activity of problems, say, in the occipital lobe, someone may be having more vision or procedural memory. If it's more in the frontal lobe, they're having a lot of problems with decision making or mood disorders. So it varies. So with that, though, if we see an abnormality that matches up with symptoms, you use a program. There's different ways to do this, but the one that we will be using, you watch a video, or watch and listen to a video, or just listen to audio. You can do it with eyes closed or eyes open. And as your brain waves go in the direction that we want them to, based on the settings, you will get to see more of the video. If your brain waves are going the wrong way, it'll go dark and it'll go quiet if you're watching a video, say a movie or something. With that, your brain actually wants to be able to see that, so it will tend to nudge, just kind of keep gently nudging the brain waves, and you can often see patients improving different brain areas, not just on redoing a map after a certain number of sessions, but they say, oh, I'm sleeping better, oh, I'm having less pain, oh, I'm thinking clear, oh, I'm able to make decisions, oh, I'm not having the mood disturbances, panic attacks, ADHD. So there's a lot of different things that this can be used for repairing things, and sometimes also for optimizing for those who aren't necessarily unwell, but they want their brain to work a little bit better. So those are some things that we are, like I said, another modality, and each person's one, like I said, may use more than one, but each patient we see sometimes fits one of those better than the other, and having more options gives us a better hope that we are going to get a person and an option that is helpful for them. So let's see, it took liver cleansing herbs. Is it okay to take liver cleansing herbs if you take antipsychotic drug? So this is some of the neuropsych medicines, whether it's anti-anxiety, antipsychotics, can have effects on the limbic system and may be helpful, especially in the short term if symptoms are very severe. But we also often use things that are improving detox, increasing the body's ability, particularly the liver, ability to get rid of toxins. Some of those toxins may be mold, Lyme toxins, mercury, plastics, petroleum products, but, and you might not be surprised, if we're removing those other toxins, you may be taking a pharmaceutical that we also upregulate the ability to detox, or sometimes we slow the ability. So we have to think about the effect of different supplements on a patient's other medications. So it is possible, depends on the antipsychotic, on what mechanism that medication is cleared by, say whether it's cytochrome system, and there's a bunch of different cytochromes, whether it's glucuronidation, whether it is glutathione being added to it, whether it is cysteine added to it, glycine, whether it is a sulfur group. That will be changed depending on how it's excreted, how it's metabolized, depending on what detox you're doing. So just saying a detox and a medication, it is really specific. Just like if you went into a pharmacy and they said, you're on 10 medicines and we're going to run an interaction checker and find out, oh, do any of these medicines maybe make a higher risk of side effects, one versus the other, or whether or not one may be lowering, causing you to metabolize faster. So it is possible when we are caring for patients, we use a lot of milk thistle to upregulate liver detox, and I will often lower that dose if I have a patient on a medication, whether it's a immune medication, whether it's an antibiotic, whether it's a blood pressure medicine, diabetes medicine. We'll want to think about that and make sure that we are not creating a problem while we're fixing another one. So it started on...
That was related to it. Yeah.
So this is a further Mental KM tonic 1 week ago. I would have to look at those, and without, if you're, I don't have a name, so which is okay. If you're one of my patients, ask me this and I can answer more specifically in a private setting on the portal where we can interact with patients. If it's not, it's probably something, if you're taking something, whoever is prescribing that for you needs to know, or you need to consult, is what liver detox, liver cleanses, are upregulating specific detox mechanisms. Is the medicine you're taking cleared by that detox mechanism? If you're turning it up, it's like you're opening the drain a little more. So I can't answer that specifically, but it is something that whoever is writing that for you needs to know about. So we do recommend for people, for patients, whether they're our patients or somebody else, to discuss what you're taking with other providers. If you don't have a functional or natural-minded provider, you need to get one. They can guide you in that. If they say, oh, well, just don't take those herbs or it won't make any difference, that's a recipe for trouble. So that's probably about as much as I can answer on that one. All right. So let's wrap things up. That's all the questions for today, but we've spent some time talking about the limbic system. The limbic system is a part of your brain, again, in the midline and outwards a little bit, that controls emotions, interacts with memory, interacts with decision making, interacts with your sympathetic nervous system, your hypothalamic adrenal axis, so cortisol and adrenaline. It can not only affect brain symptoms, subjective things, but also trigger downstream reactions in the rest of the body, including triggering the immune system, interacting with the hormonal system, turning up inflammation, interacting with the gut, as it also influences the vagal nerve, which goes down to your GI tract, controls your heart rate. It does a number of things. With that, when there's dysfunction, say from toxins, infections, inflammation, traumatic brain injury, autoimmune disease like PANS or PANDAS for kids, you may find that it is causing symptoms. It becomes the instigator rather than the responder. When that happens, patients often need some therapies to lower that, whether it's first, again, getting rid of the toxins that cause the problem, or second, using therapies like DNRS, Dr. Lindemann, Neurofeedback, EMDR, and using things that continue to cause the body to go into healing mode rather than a fight or flight mode. With that, we see patients get better and go back to living a healthier, more abundant life. So with that, we are going to return in about 4 weeks or so. I think, look on the date here, I think it is March 12th. We will be doing another Facebook Live. And I need to remind myself of what our next topic is. I think, if I remember correctly, yes, we're going to spend some more time meeting our new physician assistant, Leslie. Leslie Mullins joined us in December. And we're going to be meeting her, and then she and I will be having a little dialogue about what functional medicine is. We'll leave some time for questions. If you're new to functional medicine or not sure what it exactly means, or you've had some friends or family or just some acquaintances, you might share this with them, an opportunity for them to hear a little bit more about how functional medicine brings the best of both natural and conventional medicine together to treat root causes, to treat the whole person, and to see patients get better recover from chronic illness that has plagued them, sometimes for years. So if you'd like to join us for there, that will again be March 12th, 11:30 to 12:30, and we look forward to seeing you then. Until then, have a blessed day.